Cognitive behavioral therapy, CBT, is a well-established intervention for mitigating psychological issues by modifying maladaptive cognitive and behavioral patterns. However, its delivery is often constrained by resource limitations and barriers to access. The integration of artificial intelligence, AI, into CBT has the potential to support, augment, optimize, and automate CBT delivery. Technological advancements have led to the development of computer-based cognitive behavioral therapy, CBT, and internet-based cognitive behavioral therapy, ICBT, which use computer software and the internet to deliver CBT interventions. Online CBT platforms have emerged, partially alleviating issues related to the shortage of mental health professionals and poor accessibility. However, they still face challenges, such as limited interactivity and high dropout rates, and offer interventions that address only general cognitive issues rather than individual-specific needs. Recent advancements in AI technology have led to exploring its innovative applications in mental health services. AI's exceptional capabilities in data analysis, pattern recognition, and automation offer vast potential in the delivery of mental health services, providing new tools and methods for assessment, diagnosis, and treatment of mental health conditions. For instance, deep learning models can automate mental health assessments and diagnostic processes, alleviating the workload of professionals while enhancing the accuracy and efficiency of diagnoses. AI can also aid in detecting and understanding patients' unique needs and preferences, enabling more personalized and effective interventions. The integration of AI into CBT has the potential to reshape the practice of CBT, making it more accessible, efficient, and personalized. However, there is an urgent need for further exploration and validation of the long-term efficacy and clinical utility of AI-enhanced CBT. Key areas for future research include the development of more flexible and adaptive forms of CBT that can better meet the diverse needs of different patient populations. CBT is a structured, time-limited psychological treatment that focuses on the interplay between cognitive processes, emotional responses, and behavioral patterns. The theoretical foundation of CBT encompasses both cognitive and behavioral aspects, aiming to enhance psychological well-being by addressing maladaptive cognitive patterns and behaviors. CBT interventions typically target three domains: cognition, behavior, and emotion. The integration of AI in CBT has led to revolutionary advancements, particularly with the rise of large language models, LLMs. Conversational counseling agents based on LLMs have been developed to generate human-like textual narratives to provide psychological support. These advancements have made cognitive behavioral interventions more personalized and precise, better addressing the needs of diverse patients. A literature review was conducted to provide a summary of the extant literature on the integration of AI into CBT across the delivery process. The review aims to provide a comprehensive understanding of the role of AI in enhancing CBT, addressing the lack of comprehensive reviews summarizing the application of AI's role across various stages of CBT delivery. The integration of artificial intelligence in cognitive behavioral therapy is revolutionizing the treatment process, enhancing diagnostic accuracy, and improving therapeutic outcomes. AI is utilized in various stages of CBT, from mental health assessment to long-term treatment response and relapse prediction. In the pre-treatment stage, AI technology is employed for mental health assessment, including disease diagnosis and symptom severity, using vocal acoustic analysis and machine learning models. AI also aids in identifying cognitive distortions, which are erroneous or irrational patterns of thinking that can lead to negative emotions and maladaptive behaviors. In the treatment stage, AI technology can augment therapeutic strategies for CBT delivery, such as developing AI tools for comprehensive delivery of CBT. Real-time monitoring by mobile apps and wearable devices can collect data from patients during treatment, providing valuable insights for therapists. AI can predict CBT outcomes, evaluate therapists and clients, and predict long-term treatment response and relapse. Identifying and understanding cognitive distortions is a crucial aspect of CBT, and AI technology facilitates this process through text classification techniques. Researchers utilize various textual data as inputs to build models and algorithms that automatically identify and categorize these cognitive distortions. However, challenges arise due to the lack of publicly available structured datasets, leading to poorer classification performance. Recent advances have expanded the scope of cognitive distortion detection to include multimodal datasets, providing a more holistic perspective. Large language models have also shown promise in complex psychological tasks such as identifying cognitive distortions. Emotion analysis is essential for understanding individuals' emotional states, and AI-assisted emotion analysis has become increasingly prevalent in mental health. In the realm of AI-driven emotional support, researchers emphasize the need for more conversational and human-like responses to address the perception of lacking genuine emotional resonance compared to human interaction. Moreover, human cross-validation is essential to ensure rigor and utility in real clinical settings. AI models can predict which clients may benefit from cognitive behavioral therapy, CBT, and determine the most appropriate treatment for each person, assisting clinicians in selecting suitable candidates for CBT and optimizing resource allocation. For instance, Reghente et al. 2018 used machine learning with cross-validation to investigate the potential of functional connectivity patterns to predict obsessive-compulsive disorder, OCD, symptom severity in individuals after treatment. Combining CBT with medication or other treatments can enhance outcomes. Research has explored this possibility, finding that combining CBT with medication is equally effective and more long-lasting than medication alone. Client psychoeducation is a crucial step in CBT, involving introducing fundamental principles and techniques, aiding clients in understanding common patterns of negative emotions, thoughts, and behaviors, and coping strategies. Psychoeducation can be delivered through various formats, including mobile applications, which have demonstrated efficacy in treating various mental disorders. For example, Whiteside et al. 2014 developed the smartphone application Mayo Clinic Anxiety Coach, designed to deliver CBT for anxiety disorders, including OCD. Recent advancements in artificial intelligence, AI, and cognitive behavioral therapy, CBT, have led to the development of innovative approaches to disseminate psychological education and integrate CBT principles into various technological platforms. For instance, AI-powered models facilitate personalized psychoeducation by tailoring modules to each patient's understanding and preferences. Systems like MindWatch harness AI-driven language models for early symptom detection and personalized psychological education, delivering tailored education to individuals experiencing mental health issues. Chatbots, such as Todaki and Xiang, offer tailored psychoeducation and brief CBT sessions, enabling individuals to acquire self-help skills for managing their conditions. The integration of AI in the CBT therapeutic process has also gained significant attention. CBT intervention encompasses various strategies, including cognitive restructuring, behavioral activation, and exposure therapy. AI technology can enhance these strategies by providing targeted treatment and monitoring patients' psychological states during CBT treatment. For example, AI language models can effectively conduct cognitive restructuring, CR, by generating reframed thinking in response to negative emotional situations. Research has validated the efficacy of models like Google's T5 Transformer and BERT in CR tasks, with T5 generated reconstructions resembling original human-written responses more closely. Recent studies have also explored the use of AI models to facilitate CR through various approaches. For instance, the P8TTERNREFRAME dataset extends the reframing task to include the identification and generation of thoughts corresponding to a given persona and unhelpful pattern. The Helping and Empowering Through Adaptive Language in Mental Enhancement (HEALME) model utilizes large language models, LLMs, for CR through 3 steps: distinguishing between situations and thoughts, generating alternative perspectives, and providing suggestions that recognize the client's efforts. Researchers have also begun to examine the various dimensions of CR, including people's preferences for particular types of restructuring. A framework comprising 7 linguistic attributes for reconstructing thoughts has been introduced, and a retrieval-enhanced in-context learning model has been trained to generate reconstructed thoughts. Cognitive behavioral therapy, CBT, leverages techniques like cognitive restructuring, CR, and behavioral activation, BA, to address distorted thoughts and emotions. Reframed GPT employs GPT-3 to generate and refine reframed thoughts, while natural language processing, NLP, and deep learning enhance crossing. For instance, Li et al. And Furukawa et al. Utilized GPT-4 and T5 models to improve reconstructions and predict emotions associated with automatic thoughts. BA techniques, such as mobile apps, Aptive, and MUBs, facilitate interventions, and studies by Madhu et al. And Rathnayaka et al. Demonstrate AI's potential in enhancing BA effectiveness. Exposure therapy, ET, has been augmented by virtual reality, VR, technology, offering advantages over traditional ET. Virtual reality exposure therapy, VRET, integrates AI and interactive applications like rewind and alter game-enhanced therapeutic interventions. Notable algorithms include the BERT model for emotion recognition and logistic regression for sentiment detection. The fusion of AI with VRET and BA techniques holds promise for enhancing CBT efficacy. The integration of explainable artificial intelligence, XAI, into CBT is proposed to enhance treatment for speech anxiety in VR settings. Digital homework assignments, such as those utilizing large language models, LLMs, improve compliance. Studies have explored innovative approaches to homework, including machine learning models that recognize homework assignments and diary applications like Mindscape. AI tools, such as GPT-2, analyze homework data, predicting tinnitus handicap inventory, T, scores and enabling personalized treatment plans. AI-powered chatbots mimic human therapists, providing efficient, personalized, and accessible CBT treatment. Table 1 outlines AI tools utilized in CBT interventions, highlighting AI's potential to augment various CBT strategies, improving effectiveness and engagement. The paper discusses the integration of AI tools in cognitive behavioral therapy, CBT, interventions, providing an overview of various AI-based platforms that deliver CBT for mental health issues such as depression, anxiety, stress, and loneliness. These tools utilize techniques from CBT, mindfulness, and positive psychology to offer personalized mental health assessments, instant support via conversations, and symptom monitoring. Table 1 presents a comprehensive list of AI tools currently used in CBT interventions, including Wobot, Wysa, Uper, Tess, BetterHelp, Rumi, CloudBot, Sarthi, SchizoBot, Zhao and Emoha. Each tool is described in detail, highlighting its unique features, methodologies, and therapeutic approaches. For instance, Wobot uses decision trees and natural language processing to engage users in daily conversations and track their emotions. Wysa, on the other hand, utilizes pre-crafted therapeutic conversations developed by clinicians for safe and effective interactions. The paper also emphasizes the importance of real-time monitoring and feedback in CBT, which traditional methods often lack. Mobile health technologies have been developed to deliver CBT treatment and track users' psychological states in real time, providing valuable data to therapists. This facilitates more efficient and personalized treatment plans, addressing the limitations of insufficient medical resources. Moreover, recent studies have demonstrated the potential of AI in predicting treatment outcomes early in the therapeutic journey. For instance, Han et al., 2015, applied a novel machine learning approach to predict individual-level response to CBT using fMRI data in patients diagnosed with panic disorder and agoraphobia. Similarly, Tollmeyer et al., 2018, utilized machine learning methods to predict how people will respond when offered CBT for psychosis. Here is a combined summary of the 4 pages. The integration of artificial intelligence, AI, in cognitive behavioral therapy, CBT, is revolutionizing the delivery and efficacy of psychological interventions. AI can assist in patient diagnosis and treatment planning by analyzing patient data and identifying patterns that may indicate specific therapeutic needs. For instance, machine learning models can predict treatment outcomes based on patient characteristics and symptom severity. In the treatment stage, AI offers automated solutions for assessing therapy sessions and monitoring treatment fidelity of CBT sessions. Deep learning models can automatically categorize therapist utterances according to the role they play in therapy, generating a quantifiable measure of treatment delivered. AI can also predict client treatment adherence, which directly impacts the effectiveness and outcomes of the treatment, using minimally data-sensitive approaches based on self-attention deep neural networks. In the post-treatment stage, AI can predict long-term treatment response and relapse risks. Multivariate SVM-fMRI methods and machine learning techniques, such as XGBoost algorithms, can analyze follow-up data to identify cases with higher relapse risk and dynamically adjust prediction accuracy. Existing publicly available datasets relevant to the application of CBT and AI are reviewed, focusing on datasets for specific CBT-related tasks, including identifying and classifying cognitive distortions, conducting cognitive restructuring, and analyzing CBT conversation data. Table 2 provides an overview of datasets used for detecting and classifying cognitive distortions, highlighting challenges such as low reliability and data imbalance. The datasets vary in size, language, and data modalities, with the majority being text-based. The paper emphasizes the need for more reliable and balanced datasets to improve the generalizability of AI models in CBT. The tables on pages 25 and 26 provide an overview of various datasets related to cognitive distortions, cognitive restructuring, and cognitive behavioral therapy (CBT) sessions. These datasets, including the cognitive distortions dataset, cognitive restructuring dataset, and CBT session datasets, vary in size, language, and data modalities, with some being open source. The studies utilize different approaches, such as cognitive reframing, detection of cognitive distortions, and identification of automatic thoughts, to improve CBT outcomes. The integration of artificial intelligence, AI, into CBT has led to advancements in pre-treatment assessment, the therapeutic process, and post-treatment follow-up, improving efficiency, enabling personalized CBT, and increasing accessibility to mental health services. However, limitations exist, including the lack of multimodal data analysis, inconsistencies in AI tool development, and inadequate metrics for evaluating platform feasibility, engagement, and satisfaction. The future of AI in CBT holds immense potential, with autonomous learning and adaptive therapy systems, group intelligence support and decision-making systems, cognitive augmentation and assistive systems, and customized, personalized CBT models. However, challenges need to be addressed, including data security and privacy, ethical and algorithmic bias, model explainability and transparency, and over-reliance on AI. Evaluation of models in clinical practice is necessary to assess real-world effectiveness, acceptance, trust, and usability, taking into account training costs and impact on medical practice. The ultimate goal is to use technology to support, not replace, human-centered mental health care. The paper concludes by highlighting the multifaceted integration of AI in CBT, emphasizing its potential while providing a nuanced understanding of its capabilities, and suggesting future research directions. The dataset for cognitive distortions, as described in Section 4, is presented in Table A1. This table includes data from various studies, such as Wang et al. 2023b, Schickel et al. 2020, El-Sharawi and El-Bolak. 2024. Lim et al. 2024. Shrivastava and Foltz. 2021. And de Toledo Rodriguez et al. 2021. The Wang et al. dataset comprises 353 data entries for all cognitive distortions and 1,000 entries for normal cases before expansion, with a total of 1,644 data entries across 11 types of cognitive distortions and 2,000 entries for normal cases after expansion. The labels include 11 cognitive distortions and no cognitive distortions. This dataset is open source but lacks a direct link. Schickel et al.'s dataset consists of two subsets. Dataset crowd dist, containing 7,666 text responses across all 15 distortions, and dataset MH, which includes two subsets MHC with 1164 distorted texts and MHD with 1605 distorted texts and 194 non-distorted texts. These datasets are in English and have text modalities. El-Sharawi and El-Bolak's dataset consists of a total of 34,370 samples, labeled with 14 cognitive distortions, and is open source but without a direct link. Lim et al.'s dataset, sourced from Kaggle, has a total of 2,530 samples, labeled with 10 cognitive distortions, and is open source. Shrivastava and Foltz's dataset, also sourced from Kaggle, includes 3,000 samples, with 39.2% marked as not distorted and the remaining identified to have some type of distortion. It is labeled with 11 cognitive distortions and is open source but lacks a direct link. Finally, de Toledo Rodriguez et al.'s dataset, sourced from various sources, includes a total of 200 samples, labeled with 14 cognitive distortions, and is open source. The table on page 31 and 32 provides a comprehensive overview of various cognitive distortions datasets. It includes datasets from studies by Sharma et al. 2023c, Medella et al. 2023, Wang et al. 2023a, Qi et al. 2023, and Na, 2024. These datasets are designed to aid in the detection, classification, and reframing of unhelpful thoughts using human language model interaction, cognitive distortion detection, and cognitive reframing through machine learning models. Sharma et al.'s dataset comprises 1,077 samples with 13 labels, available in English and open source. Medella et al.'s dataset consists of about 10,000 examples of unhelpful thoughts, also in English and open source. Wang et al.'s dataset has 7,500 cognitive distortion thoughts labeled with 7 common cognitive distortions, in Chinese and open source. Qi et al.'s dataset includes 3,407 posts labeled with 12 labels, in Chinese and open source. Na's dataset is derived from the Chinese online mental health support forum Yixinli, with a total of 22,327 samples labeled with 10 labels, also in Chinese and open source. These datasets are crucial for developing and evaluating machine learning models that can detect and reframe cognitive distortions, which is essential for enhancing the precision and efficacy of psychological support through large language models. The dataset's open-source nature facilitates collaboration and advancement in this field, enabling researchers to build upon existing work and develop more sophisticated models. The authors provide a comprehensive list of abbreviations for specialized terms used throughout the paper, facilitating reader comprehension and referencing. They also present a list of references that have contributed to the understanding of cognitive behavioral therapy, mental health, and artificial intelligence. These references span multiple disciplines, including psychology, computer science, and neuroscience. The integration of cognitive behavioral therapy, CBT, with artificial intelligence, AI, and machine learning techniques is discussed. CBT is outlined as an effective treatment for depression and anxiety, and the use of AI in CBT is highlighted for enhancing patient engagement, improving accessibility, and personalizing treatment plans. Various AI-based tools and platforms designed to facilitate CBT are reviewed, such as chatbots, mobile apps, and virtual reality environments, offering benefits like reduced costs, increased convenience, and wider reach. Machine learning's role in predicting patient adherence to CBT homework assignments is explored, emphasizing the importance of tailoring assignments based on individual patient needs and preferences. The potential of large language models in detecting cognitive distortions and promoting constructive thought patterns is also discussed, particularly relevant in the context of CBT. Overall, the paper emphasizes the potential of AI and machine learning to revolutionize the delivery and effectiveness of CBT, creating more personalized, accessible, and engaging treatment experiences for patients. The references on pages 37 and 38 of the research paper provide a comprehensive overview of the existing literature on cognitive behavioral therapy, CBT, artificial intelligence, AI, and mental health. They highlight the growing interest in leveraging AI and machine learning to enhance CBT, particularly in the context of mental health diagnosis, treatment, and outcome prediction. Studies by Flemotomos et al. 2021, and Flemotomos et al. 2022 explore the use of highly contextualized language representations to assess CBT sessions and evaluate psychotherapy skills. Other references, such as Furukawa et al. 2023, and Graham et al. 2019, discuss the potential of AI to optimize thought records and facilitate cognitive restructuring in CBT. The citations also emphasize the importance of developing data-driven algorithms to guide treatment selection and predict treatment response. For example, Gunlich-Stossel et al. 2020 propose a data-driven algorithm for guiding selection between CBT, fluoxetine, and combination treatment for adolescent depression. Furthermore, the references highlight the need for more research on the effectiveness of AI-powered CBT interventions. Studies by Fitzpatrick et al. 2017 and Heapy et al. 2017 demonstrate the potential of fully automated conversational agents and interactive voice response-based self-management systems for mental health. The studies referenced on pages 39 and 40 showcase the intersection of AI and CBT, including the potential of machine learning in identifying treatment non-response among outpatients and developing CBT apps for depression. Research by Hilbert et al. 2021 and Huguet et al. 2016 highlight this potential. Studies by Isaacson et al. 2023 and Izumi et al. 2024 explore methodological choices and clinical usefulness in machine learning predictions of CBT outcomes, while also investigating the application of large language models in generating responses for CBT. The work by Jamil, 2020, and Jiang et al. 2021 focuses on the development of virtual reality-assisted CBT and mobile app-based chatbots for delivering CBT. These studies collectively contribute to the growing body of research at the intersection of AI and CBT, showcasing the potential for AI-driven innovations to enhance CBT outcomes and improve mental health care. The referenced research papers investigate the application of artificial intelligence, cognitive behavioral therapy, and technological interventions in mental health care. Studies by Madhu et al. 2022, Malgaroli et al. 2023, and Maples-Keller et al. 2017 explore the use of artificial intelligence and natural language processing in mental health interventions, highlighting the potential of AI-powered chatbots and virtual reality technology in delivering cognitive behavioral therapy. Other studies, such as those by McGinn and Sanderson, 2001, McHugh et al. 2010, and Olatunji et al. 2010, demonstrate the efficacy of cognitive behavioral therapy in treating anxiety disorders and substance use disorders. Novel technologies, like the CBT LLM model and the Schizobot system, aim to enhance the delivery of cognitive behavioral therapy and improve treatment outcomes. The research emphasizes the importance of personalized medicine in psychiatry and examines the use of adaptive virtual reality exposure and in vivo exposure in cognitive behavioral therapy. However, limitations and challenges associated with these approaches are acknowledged, including the need for further testing and evaluation. Machine learning and artificial intelligence are employed in various studies to predict therapy homework assignments, identify cognitive distortions, and develop personalized recommender systems for behavioral activation. Deep learning-based approaches are used to predict clinical outcomes in internet-delivered cognitive behavioral therapy for depression and anxiety. Automated sentiment analysis of online cognitive behavioral therapy patient texts is validated, and machine learning-driven self-guided virtual reality exposure therapy is proposed. Further research evaluates the efficacy of supervised learning versus large language models in identifying suicidal risks and cognitive distortions. Novel applications of GPT-2 in cognitive behavioral therapy and mental health chatbots delivering cognitive behavior therapy are presented. The studies demonstrate the potential of technological interventions in mental health care, but also highlight the need for further research and evaluation. The literature review encapsulates various studies focusing on facilitating self-guided mental health interventions through human-language model interaction, specifically cognitive restructuring. Techniques such as machine learning and natural language processing are employed to detect cognitive distortions in mental health text, patient-therapist interactions, and clinical conversations. For instance, Schickel et al. 2020 proposed a method for automatic detection and classification of cognitive distortions, while Singh et al. 2023 developed a system for detection of cognitive distortion and emotion cause extraction. Research also delves into the application of artificial intelligence in depression assessment, cognitive behavioral therapy, and emotion recognition. Sadiqua et al. 2023 presented IDA, an artificial intelligence-based depression assessment system, whereas Striegel et al. 2023 proposed a deep learning-based dimensional emotion recognition approach for conversational agent-based cognitive behavioral therapy. The review highlights the importance of human-language model interaction in facilitating self-guided mental health interventions. It underscores the potential of machine learning and natural language processing techniques in detecting cognitive distortions, cognitive reframing, and emotion recognition, ultimately contributing to the development of more effective cognitive behavioral therapy approaches. Furthermore, the section presents a comprehensive overview of existing research on cognitive distortion analysis, depression detection, and mental health applications using large language models. Wang et al. 2023a introduced the C2D2 dataset, a resource for cognitive distortion analysis and its impact on mental health. Other studies have explored the use of large language models for mental health applications, such as Patient Psi, a system that simulates patients for training mental health professionals. The literature also emphasizes the significance of cognitive behavioral therapy for mental health conditions, with studies reviewing the current progress and future directions of internet-based CBT for depression. Overall, the studies discussed demonstrate the growing interest in using large language models and machine learning techniques for mental health applications, highlighting the need for further research to fully explore the potential of these approaches and address existing limitations and assumptions.